will invite our next speaker. Okay. Dr. Manoj Khatri has joined us from Chennai and is a consultant at IDOC Hospital and also visiting consultant at Apollo and Mohan Rajan Eye Institute, and is a member of Managing Committee of VRSI and Tamil Nadu Society. Welcome, Dr. Manoj.
Thank you so very much, Viral, and the entire panel here, esteemed panel, as well as AIOC, to give us this opportunity time and time again to conduct this course. I think year on year, successively we are conducting for last several years. So the topic aside today to me was medico-legal aspects of tele-ophthalmology. Where do we stand today? I think no ophthalmic practice is without of use of technology nowadays, and though we wanted to have a good show of hand, I am quite sure that all of us are today using some kind of technology in our practices, and we should also be well versed with what are the medico-legal aspects of which can arise. Nil financial interest is my talk, but you should always be financially protected, has been highlighted by Dr. Viral and will further highlighted by Dr. Santosh sir, so that if any undue thing happen in future in your practice, it can be legally as well as financially covered for you. So what do we mean by telemedicine? Let's understand few terminologies here, because this is where the court of law will hold you guilty against of any wrongdoing or any mishap. So WHO tells us that telemedicine is any delivery of healthcare services using information and communication, which can be in form of technology for the change of valid information for diagnosis, treatment and prevention of disease and injuries. It can be even for research and evaluation, and for the continuing education of the healthcare providers, with distance is a critical factor here. So this is the basic definition. Few of the differences, telemedicine, here the healthcare professionals and the patients are distant. Okay, the patient is not sitting in a clinic. Telemedicine allows us the reliable transmission of medical information through text, sound, images, whichever way you want to use it, for the prevention, diagnosis, treatment and monitoring of patients. And the accessible healthcare is the real goal of telemedicine or tele-ophthalmology as per se. So in which way telemedicine in ophthalmology can be practiced? In different formats. I've taken just few main formats on which platforms we are already using it. So we are using it for access of healthcare to patients in the remote area. So this is mainly through CAM-based screening. Patients seeking second opinion. This is one of the major chunk of patients. And this can be cross-border or even cross-country. Preventive medicine by giving patients information on their health condition. This is one of the other main goals through TV media and so on, all online media, and monitoring of the patients. Now, different ways a registered medical practitioner in any specialty can offer use of this tele-ophthalmology. It is not only limited to ophthalmologists. Mind you, you have to understand this. When we say tele-ophthalmology, there is no set definition by Ministry of Government of India or by Tele-Ophthalmic Society of India that it can be practiced only by an ophthalmologist. So here there is one gray area. It is directly from patient to registered medical practitioner or caregiver, that is the people who are working in the field, RMP to RMP, that means from consultant to consultant, or health worker, again these people are working in the field. So these are various subheads. But why these subheads are important to understand is because only the RMP will be liable for any legal action against that particular act or particular thing which you have done. So ultimately the fault is only on the doctor or the organization who has instituted it. Is it safe? Where clinically appropriate, telemedicine is safe, effective and a valuable modality to support patient care. Early morning we had a session on AI in ophthalmology, and AI based technologies are again coming into the radar of tele-ophthalmology medical legal aspects, and we have seen there is a referral base which has increased 9-folds to your base hospital. So that means you are using technology to increase your referral and treatment base, but it has to come with not on the cost, it should be a safe and effective modality of treatment. Like any other technology, the technology used for telemedicine services can also be abused by you, by your staff, by the aggregators and so on. It has some risks, drawbacks and limitations which can be mitigated through appropriate training, enforcement of standards, protocol and guidelines. And these guidelines should be used in conjunction with the other national clinical standard guidelines, protocols, policy and procedures. So what does the law says as of now? Pre-COVID, the law was different. Post-COVID, the law is completely different. March 2022, when the COVID stuck, Government of India at the same time has revisited this, and we will be seeing in the next couple of slides. But the law clearly says that ignorance of the law is not considered an excuse. Current law status, there is currently no law in India specifically pertaining to telemedicine or teleophthalmology. While the Information Technology Act of 2000 dealt with information technology, it did not address any issues in relation to healthcare. Legally, this has led several people to question the legality of telemedicine or teleophthalmology practices, which is happening in India for decades now. It's not only for years. However, GOI and Niti Aayog, as I said, March 2020 revisited this gadget, and they have raised this in Parliament as well. But the Parliament was unable to pass it, so only a telemedicine practice guidelines, this is freely available online, has been passed, and it has been practiced and revalidated in 2022 as well. This has been released by Government of India as telemedicine practice guidelines, which have been incorporated as Appendix 5 of Indian Medical Council Act. These guidelines have been prepared in partnership with Niti Aayog. The purpose of Niti Aayog guidelines, this you have to understand it very clearly. They just wanted to assist the medical practitioner in pursuing a sound course of action to provide effective care. This is just a basic care. Help realize the full potential of advancements in technology, provide information of various aspects of telemedicine or teleophthalmology, and spells out how technology can transmission, in any form, can change the practice protocols and policies for this patient to give them the best of the care which is available. Now, there are certain guidelines for the people who are using technological platforms. We have seen Remedios and other mobile apps, cameras, and so on. They are using certain guidelines, but most of these guidelines have been violated in Indian scenarios. But as a registered medical practitioner, we should not be violating these guidelines. So the technological platforms providing telemedicine services to consumers shall be obligated to ensure that the consumers are consulting with RMP only, with National Medical Council registered practitioners, and to comply with relevant provisions. Technological platforms are there to assist you and not to make misuse of it. Technology platforms based on AI, machine learning are not allowed to counsel the patients or prescribe any medicines to treat a patient. Only a registered medical practitioner is entitled to counsel or prescribe and has to directly communicate with the patient in this regard. So your people who are working as staff in remote areas, they cannot do any kind of prescription. This has to be, point has to be noted. There are certain, many gray areas. I have picked up some 10 or 12, and this depends on region to region. So one is on the regulatory ambiguity. There is still a lot of regulatory ambiguity as how you are going to regulate as compared to the cities to the rural areas. Scope of practice, quality of care is still questionable mark, patient safety, informed consent and continuity of care, as well as equity of and access and reimbursement if something goes wrong. Where are we in the court of law? These are set protocols written by Niti Aayog, but it's not that key, this implies to the usage of teleophthalmology. It just collects the basic medical data of the patient and what can be the diagnosis and the possible treatment protocols. To our surprise, when I checked on the list of medicines which are available to be prescribed in ophthalmology, can you name a drug which has been allowed by Niti Aayog or Ministry of Health for the treatment of conjunctivitis on telemedicine platform which you can prescribe? There's only one drug which is ciprofloxacin eye drops. No other eye drops has been advised by Government of India. So there are a lot of gray zones still which are not very clear, so we need to keep ourselves legally safe. However, we should also be seeing that how the AI or the teleophthalmological practice is going to change the future for all of us. Legal point of view also, what can change in future? So it can change the reimbursement and insurance coverage for the patient, very important point. Cross-border telemedicine, we are doing it, but cross-border, acceptance of technology or even the challenges which can thrown on the legal sector can also be there. Regulatory flexibility and innovation, also licensing and credentialing, privacy of data, malpractice and liability. So few take-home message which I want to drive is usage of technology is increasing. However, we don't have any clarity as of now from Government of India on the rules and regulations which can protect or destroy you in the court of law. We should always be beware of aggregators, especially on the online platform, who are even selecting patients from the AI-based platforms and getting to you and telling you to treat it. Beware of unregulated insurance providers, beware of online practices. Data can be breached quite easily, and legal protection is still not unclear ground, and as of date, consumer has a upper hand. So can I or can we? Yes, we can use the technology, especially for screening, research, collaborations, and AI-based incorporations. However, we should not be deciding on treatment protocols. Surgical advice is only by RMPs. Online aggregators, we should be careful. Trained manpower is the need of the hour, and be legally safe. Thank you so very much for a patient hearing, and thank you, the organizers, for the wonderful opportunity.
Thank you so much, Dr. Manoj, for nicely presenting about this burning topic of tele-ophthalmology. As we all know, tele-ophthalmology is going to be future, and use is going to increase day by day, and with it, the menace of litigation will also increase, as we have seen in the famous case of Sushant Singh Rajput